Hello, this is Child Crest, and it is all about the child. We'd like to thank you very much for your support when we ran our first series on nutrition. This time, we shall focus on community health. Remember that all communities need good, healthy living to be at par with the global expectation. What exactly is community health? Let me hand you over to Timileyin, who will set the pace for us. When we come back, we shall start the discussion with somebody who has traversed various communities in Nigeria with his health practice, and of course the globe. This is Child Crest, open for sponsorship. Let's give you this report. We'll be back shortly.
On this program, we're going to be looking at community health.
On this week's edition, we bring you clips and our interactions with people from different parts of the Federation.
This was our first dispensary. The community decided to improve more, to add maternity to the existing dispensary. So this maternity came up.
How healthy is our community?
In the rural area, child health diseases, they are really very rampant because it took a lot to convince them to immunize their children against all these common ailments. And because of some of our beliefs, they don't really think those are the causes. But with enlightenment and demonstration, I think they are picking up. We still have issues. People not willingly wanting to go to the health center, or they want to go and do self-medication.
There are small things that still comes out. We call them those days, the primitive days, we call them opepe. There is still opepe. There is still this thing ogie.
Ibo, now do that one. Since they say pikin not the drink blessing, not the soaky blessing. Na cow chia. So na milk when they drink, na cause am. Yes, before they not they do such like that. Because now blessed we soak.
We have a health facility here. If somebody is sick, we have to go to Auchi or Iyakbi. But at present, we have a maternity or clinic at Ireku. We have applied for a health center in this village because it's very far from here to somebody sick, carry him for about 3 kilometers or so. That's why we asked for a health center.
Vomility, stooling is always rampant in this community most of the time. Then malaria mainly. And at times, some of them will be passing blood in their urine. Like 2-3 weeks ago, I treated somebody on it, passing blood in urine.
This is PAC Ibiana First Clinic, and this is our labor room. Here is the delivery bed. You can say that the delivery bed is not what to even deliver a patient. We need good forceps for delivery forceps. We need scissors.
Clinically, one can barely say it's what we see most cases of febrile illnesses, which could be due to a number of conditions too. The commonest one around us is malaria, and thereafter you have the enteric fever, which people refer to generally as typhoid.
This center, we don't have a good toiletry and bathroom here. But when the women came here, that means that if they deliver, they will just go after that day, because they don't have conducive place for them to go for toileting and the bathroom. So again, we don't have the bath. Some of them bath inside this old house here.
What is affecting us in this our community? We were lack of road, we were lack of health. There's no hospital, nothing done. It's only the UNICEF. They are the people that even brought up to let us know the importance of health in this community, and we thank them.
Wọ́n ní wọ́n máa bá wa ṣe ibẹ̀ yẹn pé wọ́n máa fi dá ọsibítù ilẹ̀ wọn dẹ̀ dá sílẹ̀ àtẹ̀jókòó ń tiwa. Wọ́n dẹ̀ ní kán dáwó kẹ̀kẹ́ bá ní àdá.
Hello, this is Child Crest.
And in the kitchen, when women are cooking, food hygiene goes a long way.
Potty training involves getting a child to be continent of stooling and urine.
The parents feel stigmatized and treat the child differently from how you treat other children.
She is a protector, a giver, and a shield. There's so many things that are being abused. Herd immunity applies only to contagious diseases.
By making sure we wage war against rodents.
You look at the toys that you're going to buy for the child, especially children under the age of 2, you need to look at toys that they cannot swallow.
This time, we shall focus on community health.
Join us on Child Crest every Sunday at 10:30 a.m. on NTA Network. Child Crest, it's all about the child.
Welcome back. The program is Child Crest. Thanks so much for that background report. Now, let's look at community health. It's my pleasure to welcome to the studios of Child Crest Dr. Mahmoud Dako. He is the medical director of Dako Specialist Hospital and, of course, Dako Foundation. You're welcome to Child Crest.
Thank you very much.
Now, I know this is your familiar terrain. How can we describe community health, sir?
Well, community health is the health of the people living in a particular community. And community health care is the healthcare services rendered to people in such a community.
Okay, if we look at the Nigerian setup now, how can we categorize the various communities in our country?
Well, various communities in this country, there are different communities in this country. For example, where we are here in the Budementa is a community. So the people that live in a particular locality constitute the people in that community.
For instance, we look at the rural setup, the urban setup, the tertiary institutions. You know, these are isolated communities on their own.
Yes, you have the urban settings and you have the rural settings. And even in the urban area, there are still people we also call urban-rural communities.
Okay.
So they are scattered all over the country.
How about urban slum? I heard that.
Yes, the people in urban slums are the ones that describe as the urban-rural community people.
Okay. Now, of interest to us is, I think the government, not only in Nigeria, they have set up how people in the urban setup or in all the communities would have adequate health facility. And I'm sure that's what's brought about the primary health care. How well has the country fared in this?
Yes, the primary health care services, like I said, the primary health care is provided in communities. And they have been in existence right from the time of our existence, but in 1978, during the AMA convention in Kazakhstan, that was when the declaration of primary healthcare delivery system was actually declared. And since then, primary healthcare delivery system is the vogue all over the world.
Okay, is that the same as the basic healthcare? Is this the same?
Yes, that's the basic healthcare system or the essential healthcare services.
In your travel, I mean, your sojourn to communities, do you think that this primary healthcare has really met the need of the various communities you have visited?
No, I've actually visited communities in Nigeria, in the US, in the UK, in Australia, in Brazil, and many parts of Europe. I mean, just like any other thing, the primary health care services in Nigeria actually mimic exactly how things are done in Nigeria. So it's a very poor state.
Pardon me? How are things done in Nigeria?
Well, we usually have what we call the Nigeria way of doing things.
Nigerian factor.
Things are never done properly. The system is there, just as it is in other places. They implement their own very well. But at the end of the day, you see, we do our own, the so-called Nigeria way, and things don't go on well.
Okay, what is missing that you think, because I know you visited a lot of communities, what's missing, particularly in terms of health care?
What is missing is quality of care and availability of care. Both of them are missing, and this infrastructure, the physical infrastructures are there, in fact, bigger than what I see in other countries, but the personnel and the operations themselves are lacking.
Okay, in terms of the extension workers now, I'm sure that's what you mean. How well has that fared? When you say, okay, take people to the rural setting, the primary health care center, for them to, perform their duties?
Yes, I think apart from Lagos State, which has done very well, I must confess that, because I've visited health facilities in Lagos State, in rural areas, they have done beautifully well. They compete very favorably with what happens in other countries. In our rural settings, the facilities are not just there. The personnel, they are not there. That is not what is, these are the two that are lacking. They are not there.
What kind of personnel are we looking at?
Medical personnel.
Must they be doctors or midwives or nurses, to at least knowing that there's a dearth of qualified doctors? Must doctors be at all primary health centers?
Yes, that is true. The essential services we talk about can actually be provided by qualified midwives and general nursing personnel, and they refer cases to the available doctor in the nearest comprehensive healthcare services. That was how it was designed. But unfortunately, some of our healthcare facilities don't have those personnel.
Okay.
And where they do, some places, for example, because of the bad terrain, they don't, they are hardly ever present in such facilities. You can stay in such facilities for a whole week without seeing a qualified personnel.
Okay, interesting. We'll dwell more on infrastructure and even the facilities itself. But earlier on you said, well, kudos to Lagos State, they've done well, but there are some places that still don't feel the need for primary health centers. You will be shocked that we visited a place and they didn't have any presence of a PHC at all. I don't know if that is good enough.
Yes, I think the problem of awareness is also there. Many of them don't know that when they go to such facilities, they can get the basic things. In Lagos State, for example, I think antenatal care and children under 5, they are entitled to free services. And from the experience I have gathered in Lagos State, such services are actually provided for this category of patients when they do present themselves. But I think some of them don't know that they are entitled for such things.
But when you have a community that don't have, maybe a conglomerate of 1, 2, 3 communities that don't have any presence of primary health care at all, is that not a disservice for them?
Well, it is, but unfortunately, there's no way any government can actually carry the services to everybody's doormat. Apart from Brazil and Cuba in particular, some people still have to trek some distance before they get to the nearest health facility.
Okay. Now, I'm still chatting with Dr. Mahmood Dako, the medical director of Dako Specialist Hospital. Talking about Access Road, we actually took a trip to Jagbe, a community in Edo State, Esako West to be precise. Access Road is a major problem there. Let's take a sound bite from the matron in charge. We'll be back to continue the conversation.
For us to refer patients out, even for the vehicle to carry patients out, is very difficult. Where we're supposed to pay 13 naira, 15 naira, we'll be paying 200 naira, 250 for the motorcycle to carry us out. So it really affects us.
Yeah, welcome back. The program is still Child Crest, and I'm sharing thoughts here with Dr. Mahmood Dako, the medical director of Dako Medical Center, and of course, Dako Foundation. Now, share your thoughts with us from some of the communities you have visited, particularly in terms of the community, the inhabitants themselves. How disposed are they to get this health facility if made available?
Well, there are many factors actually mitigating against such facilities get to the people. But one is security. For example, in one of our trips, we were lucky to be kidnapped, and that's scared off from that community today. We don't go to that area again. Then the habit of the health workers is also a problem. Some of these communities, the health workers see themselves as private practitioners. They charge these patients exorbitantly, And because they have no option, they just have to pay and get the services, which of course are never as good as what we expect in a society where the adequate personnel is readily available. Then of course, fake drugs. That's another problem we have, especially in the suburbs. Expired drugs. I mean, we've made trips to some communities where we paid improper visit to their pharmacy, and what we saw there was alarming. These are major problems.
But what is the control of all these things you have enumerated? How do we forestall them?
Well, in terms of drug quality control, NAFDAC has done a good job. I think we're aware of that. But they cannot be everywhere. And they also need the cooperation of the people. And in rural communities, with poor access, with poor presence of government, there's not much that NAFDAC can do to control some of these things. And for security, where security is a major problem, all of us should be involved in it. But what baffles me is when we come to a rural community to give free service to people, and I mean, the community cannot actually protect you. People come into that place, kidnap people, and nothing is done. And they don't make any attempt to assist in getting the people. They behave as if they are part of the kidnapping team. So these are some of the challenges I think we are having today.
Okay, in the area of personnel, we can't but emphasize on that. Some of these staff and extension workers probably feel that the urban setting is best for them, so they don't warm up to go to the rural setting, knowing that it's service to humanity and mankind.
Yes, you are very correct. That is one of the reasons why we set up our own foundation. We want to actually mentor a lot of young people, doctors, nurses, laboratory personnel, so that they love working in rural communities. They will enjoy it. But one thing is certain again is that if we adopt the policy that is being used in Australia, to be specific with the Aborigines, this problem will be sorted out. If you make the people to own the healthcare facility, they'll be able to encourage their people to take over this, and it will be easier for us to control and get better results.
I can't understand that. Yes, you have situated a health center in a community, and then the facility is just not there. Or in the name of situating a health center or constructing a health center, it's just someone like a facility that is not equipped, well equipped for the inhabitants.
Yeah, I think just like education in this country, I don't think the government has enough resources to actually fund this facility. This is the truth. But for political reasons, they will tell you they can do it. I believe that if the communities are made to own such facilities, they will do better.
What do you mean? Own facility? These are government facilities. You mean they be part owner? Is good? That's a challenge.
Yes. I gave an example of what happens in Australia among the Aborigines.
Okay.
Government sets up the facilities. They provide the enabling environment, but they make the people know that this is your facility. Make it work. We work with you. We decide. We help you to decide how it should be run, but it is your own. Whatever you think is necessary, we work with you to get it available. What if government does that? What government cannot provide, the people in the community will know that it's a necessity. They will work with the government to get it, and things will go on well. After all, the people in the community that benefited, not government.
Well, we're talking of people, but this program is Child Crest. How well do you think that all these medical centers and medical public ones, or even private, and what have, really, forestall good health care for the child in our country?
Like I said, apart from Lagos State, I will say it again because I've visited their facilities, almost all other states, not easily existing. You get there, you can spend the whole day, you won't see any health worker to attend to you. If you are attended to most of the time, it's not available, you go and buy. You go to anywhere, you buy the one that you can afford, sometimes low quality. And I think it's just God's grace that saves our children.
So what's the way forward?
The way forward is that the communities should be encouraged to own their health facilities. Working with the government, they provide what they need, and they can also control the health workers.
Okay.
If the health workers know that there's somebody in the community that monitors their activities, they will perform better. They'll be punctual to their job, and they'll be regular. But if it is the government in the state headquarters that is in charge, or in the local government headquarters that you don't see often, especially in rural areas with poor access, it's only when they know somebody is coming to check them that they go to work. If the community are made to know that this is your facility, you own it, they will encourage workers to perform and the workers to do well.
Well, very well said. I'm sure we thank you very much for coming, except there is any counsel for both the patients, the populace, the medical personnel, the staff, the government. I say final words to advise everybody.
Well, government should be sincere, and when it's not available, when it cannot afford it, you tell us so that we know that they cannot afford it. For the patients, when you are ill, go to a health personnel. Don't patronize quack, because at the end of the day, the quack will do a lot of harm to you. And for the health personnel, please realize that if you are not doing the right thing, God is watching you. The people cannot do anything to you, but God is watching you. We should try as much as possible to deliver what we have promised to do.
Thank you very much, Dr. Mahmoud Dako, Medical Director of Dako Medical Specialist Hospital and Dako Foundation. Thank you so much.
You're welcome.
Safety of our children starts from our home, as we are parents busy every day doing all our activity to earn some living for these children. From the young age, we look at the ABC of safety. The A is critical in terms of the airway. So when you look at the toys that you're going to buy for the child, especially children under the age of 2, you need to look at toys that they cannot swallow. One of the commonest causes of death is swallowing small toys that we cannot get out of the airway. And if this happens, it takes only about 2 minutes for this child to die if it's not appropriately treated. So we make sure we buy appropriate size, which is normally labeled at the back of a good toy for the appropriate children. Then we go to the B of life, which is basically bleeding. In our home, we need to make our home safety. You look at the bathroom, it has to be a safety area. Non-slippery floor is very important. Tight edges must be very rounded up, no sharp edges. We must also know in terms of bleeding that sharp instruments like blades and knives should be kept away completely from the child. And if there's a bleeding, the first thing for you to do is to control the bleeding. Please make sure in your house you have a clean piece of towel or cloth that you can wrap around that area after having soaked it in water.
That's the program today. Open for sponsorship, and we have started a series. We have a lot more that awaits you. We'll talk of hygiene, toilet habits, immunization. All these are relevant to ensuring good community health to our populace, particularly the children that the focus of this program is meant for. It's child-centered. Again, sponsor this program so that we can endure. Do make it a date with us same time next week when we shall bring you a fresh edition of this program. Until then, bye for now.